Breaking the gray.
Sarah.
Hey, Russ.
Now that we're on YouTube and our YouTube channel, we now can see each other. The world can see where we are. Looks like you're hiding in a basement somewhere. Are you okay?
I'm locked in a basement.
You didn't make any hand signals.
No. The
Okay,
universal. No, I'm all good. I'm in a basement in upstate New York.
Yeah, I've seen many a horror movie about that, but I'm glad that you're safely in the basement. And so you're in the U.S. I knew there was a cosmic shift that happened over the last week or so with you being here in the United States. So thank you for being here.
Yeah, it's a pleasure, and it's lovely to be back stateside with all these lovely people. So
wonderful.
Very cool.
Well, we have an amazing guest today.
Yes, I'd like to welcome Dr. Mitchell Yass, not one of our little black book people that we've met before. So it's very cool to have some new faces. So thank you so much for taking the time today, Dr. Yass. It's really great to have you on.
Thank you for having me. And I'm always open to explaining my method and why it's so valuable to getting a proper diagnosis and resolving people's pain. It is by far the number one health issue in the world. There's no question. And people are definitely looking for the answers. So I'm happy to be here and share what I know.
The number one health issue you think is chronic pain?
By far. So 130 million Americans, roughly 1 billion people worldwide, are suffering with chronic pain.
Wow, that's a big number, isn't it? Yeah. What do you think the reason is for that everybody's, in so much pain all the time?
So you have to look at, number one, what led to the massive rise in acute pain, and then how did that become chronic pain? And basically, for people who understand, chronic pain simply means acute pain that has been consistent for more than 3 to 6 months. Then it becomes considered chronic pain. And I got into this actually I became a physical therapist, actually. I got my license. I don't really practice as a physical therapist, but I got my license right at this inception in the early 1990s. And so what happened was I started seeing all these people of all ages, from the teens all the way to the 90s. And I started saying to myself, well, chronic pain has never existed in the history of mankind. Why is it happening now? I came to the realization it was the advent of technology, automation, telephones, cell phones, computers. And what basically happened in the mid-1990s, where we went to a situation where most jobs or occupations were no longer being performed manually. It was all being controlled through a computer. And in fact, the biggest job in the world that exists is IT, a job where you sit for 8 to 10 hours a day on a computer. And so what happened was people stopped using their muscles. And as a result, they became susceptible to straining. And as a result, when you then did try to do something, you were susceptible to straining and eliciting pain. So we had this situation prior to this where the type of person that was really suffering from some sort of chronic pain was a retired individual who sat on a rocking chair, and then when they decided to do something, got pain. Now you had all these people down to their teens suffering from pain. So that is the rationale as to why we ended up with this massive number of people in pain, but why chronic? Well, part of the technology that developed at the time was the MRI. The MRI identifies structural variations like herniated discs, arthritis, stenosis, meniscal tears. And because they're identified for the first time at the time of the pain, it was asserted to be the cause of the pain, also known as correlative theory, and we could get into that. But because of this, that's what got treated. As a result of that, the muscular causes, which don't show up, ended up remaining and continuing, which is why people, even today, 40 years later, are suffering with chronic pain.
It's one of those things where in Buddhism, they tell you not to identify it or name it, because once you identify and name it, it becomes something. So 2 parts to that, then I guess. One is we become weak, right? We become a little less pain tolerant because we sit on our tush all day. And were on our computers. And then I imagine because the telephone, then we had someone to complain to. And with social media, we got to identify that other people were going through similar things as us. And then we got the MRI to be like, see, I told you my back hurt. So it's just a full circle of us just, not being as tough as we used to be, I guess. Is that what it is?
Yeah, and maybe even a double whammy of the technology. We're also sitting in a load of non-native EMF fields as well. It's kind of a double whammy. Not only are you sitting for, 9 hours a day, but you're also sitting kind of in an environment that's not a natural environment.
It's very true, yeah.
Sure.
Well, I was going to say, you and I were talking earlier about being able, manufacturing and production and having factories and having a factory job at a coal miner. Like, you're on your feet all day, right? And you're not really identifying with the pain because you're working. But were they in more pain because they were working harder than we work today or working in more strenuous jobs?
Well, there's actually no indication that chronic pain existed prior to the early 1980s. There is absolutely no indication. Oftentimes, we like to talk about this opioid epidemic, right, that developed in the mid-1990s. Well, you have to understand it takes billions of dollars to develop these drugs. You don't decide to develop the drug and then see if there's somebody who needs the drug. There has to be a demand before you create the supply. The reason that they developed in the mid-1990s is because the chronic pain epidemic developed in the late 80s to early 90s. So you had this mass of people now suffering with pain who they could not resolve that cause because they couldn't identify the cause, which left you at the point at which all you could do was try to mask the symptoms. That's where that came.
I'm going to say I blame Oprah. I blame Oprah. It's right when she came about, right? She had all these people on talking about like, oh my gosh, it must be so hard for you. I blame Oprah. Oprah started the whole thing.
It's a conspiracy started by Oprah. You're right.
Oprah
I agree.
Started this. So, but is it that they weren't feeling, I mean, the average age of death was probably a lot younger back then too, right? So they were dying from things, but they just were not feeling the same amount of pain. Is that what it was? I'm curious, or they just weren't telling people? Like, how did it not exist?
The body has developed over evolution. The body is designed to do activity as it was meant. That's always been since the time we walked on two legs, right? So it wasn't that there was pain and it wasn't identified or presented. There simply was no pain. Postmortem studies of the 1950s showed 40% of the population had herniated discs. The very herniated disc that you're being told today caused chronic pain. Where was the development of all these pain medications, all these treatments, everything that happened? Where was it back then? It didn't exist.
But I mean, surely in Victorian England and all that, when they were all in the factories and stuff like that, there was a lot of pain. They were all taking laudanum and stuff, weren't they?
In Victorian England?
Well, when the start of the Industrial Revolution, when you had everybody working on the mills and down the mines and in the paper press, there must have, there were a lot of people who were doing they were doing manual work, but very repetitive to the point where it's not a functional movement. That's kind of a natural movement.
Right. So if you want to talk about that concept, then you have to recognize that based on the fact that everybody on this planet, for the entire time this planet has existed, lives in a gravitational environment. Okay. So there's always this force being pushed down on you. For you to do anything other than laying on your back, you have to push against that force. The purpose of your muscles is to apply an equivalent force output to meet that force requirement. That's how the body works. Now, you could take a classic example. Let's take the tennis player who develops and continues to develop at a higher level. If you looked at their tennis arm, you would see that their tennis arm grows, atrophies to some level because the requirement is greater, but it doesn't keep growing. The tennis player doesn't become Arnold Schwarzenegger because you have to actually cause individual muscles to push against greater and greater forces to make it develop. So what happens is you will have a period, an area where you can cause some development of muscle, but eventually if the force requirement gets too great, then the muscle will break down. And that's what you see with the highest level athlete. They can develop to a point without strength training, but at some point, the force requirement gets too great and they break down and they have pain from that breakdown. So you have to recognize that generally there is this some area where force requirement will lead to some increase or lessening of muscle, but it has to stay roughly within that realm. If you sit for 10 hours and don't use your leg muscles, they are going to weaken to the point where there's just no chance that they can push against gravity when they need to, and you will strain and elicit pain.
I see, which is what we're all doing. So maybe you can go a little bit then into your method of dealing with it, because I mean, I think, like you say, there's so many people who've got chronic long-term pain, but all of us have experienced certain periods, even if it's acute, of pain for a certain amount of time. I mean, we are very sedentary animals right now. So really, what is your solution to this?
So basically, what the Yass Method says to do is what Hippocrates told you to do, which is that to understand what tissue is in distress, you need to perform a history of what's happening and then look at the symptoms that are associated with the tissue. Every tissue elicits very specific symptoms, right? So I try to explain this. If someone has an ankle pain, do they think they're having a heart attack? Of course not. But if you have pain in your chest and your left arm, you're going to have a heart attack. You're going to go to your doctor. Right? If all of a sudden your whole left side of your body goes numb, you don't say, don't worry, I have an appointment coming up in 6 months. You say, shit, I think I'm having a stroke. I better go to the doctor.
Yes.
Right?
Yeah.
So there is a general perception of people understanding that specific tissues create specific symptoms. It's just that when it comes to the neck, the back, and the extremities, that's been taken away because the medical system has programmed you to say, well, if I'm having these symptoms, I just have to get an MRI and it's going to give me the answer. The Yass Method says no possible way. Theoretically, clinically, and scientifically, the MRI is baseless in identifying the cause of pain. In every one of those categories, I can tell you exactly how I know for sure it's baseless. So the only way you could really do this is to interpret symptoms. Now, pain is not a symptom onto itself. So let's say you're having lower back pain, okay? And I wanted to see whether it was muscular. Muscles are not just responsible for being muscles, they're responsible for posture and movement. So I might look at that person and say, let me check their posture. And I might find that person with low back pain to have an excessive arching in their lower back. So would the identification of an excessive arching along with the pain corroborate that the tissue in distress is muscle? Yes. Would it matter if a herniated disc was found? No, because how does a herniated disc have anything to do with arching of the back? It doesn't. How about change of range of motion? The person then, I say, bend down and touch your toes, and they can't, right? Well, is range of motion a corroborating factor? Yes, it is, right? A herniated disc isn't going to change that. How about the fact that when you sit for a while, that's fine, but if you stand up, you have pain? Well, the psoas muscle, which is attached to the lumbar spine and the hip, will shorten severely if you sit. And if you don't have an opposing force to stop that from your butt muscle being strong, when you go to stand up, that muscle cannot fully lengthen. It's going to pull on your low back and create pain. So we have movement patterns. We have postural variations, range of motions, palpation. What if I just touch your hip flexor and you say, yes, that's my pain? That would be corroborating. So what you start to understand is that the body's actually presenting quite a lot of symptoms to confirm exactly what tissue is in distress. That's a lot better mechanism than just looking at a picture that is taking a point in time, which cannot justify whether that may have been there for 20 or 30 years, and also presenting that that's the cause of your pain just because it exists. Well, the fact is many people without pain have that same structural variation.
I had a situation happen to me. Right when COVID started, I was having a lot of stomach problems, and Sarah and I were doing our podcasting and talking about this. But so I went and I got a full CT scan. I got all my scans done. It was wonderful because the hospital was empty, and I basically was like there for 2 hours and got every scan I needed to get done. And they came back, and there was no diagnosis except that I had a hernia in a certain area of my body. So when they showed me the picture, I was like, oh, that's exactly what it is. It's a hernia. So then I'm like, oh shit, I got a hernia. So now I got to go get the mesh treatment and got to do all the stuff. I call my doctor again. He's like, no. He's like, that's the kind of hernia that self-heals. It's just because you got a CT scan. So for 3 weeks, I was suffering from a hernia. And I was like, oh, this is great. All my innards are going to end up down by my genitals. Like, this is terrible. But the reality was that they named it. And I think our brain does this thing where the minute they tell you something that you have wrong with you, you identify with it. And so we talked about this with cancer, right? It's like with this, the minute you find out you have cancer, now you've identified it and it's yours. And now you're like, oh, now I have to do something about that thing that's mine. And you start to like play into that role a little bit more versus stepping back a little bit and saying, can we treat it? And so I guess what you're saying, Dr. Mitchell, is that we're like, let's identify what's really going on and let's address that rather than taking,
rather than addressing something that's shown up on a medical examination. I also have a similar experience because I have like chronic pelvic pain, but it's not so like, if you've got an arm pain, you can kind of identify it. But with pelvic pain, it's actually quite difficult. And so my doctors have sent me to a gynae, to gastro, to structural, all of them. And actually all of them have come up with a solution for me. So the gynae lady's like, okay, I can see a few little fibroids. Let's just take those out. And I'm kind of not into that because it's basically just people with one specialization that are not looking at the whole picture and they just want to do the thing that they can do. And I even said to the gynae lady, do you think the fibroid? She goes, no, I don't think it is that, but we'll do it anyway. And I was like, no way. Why would you have a procedure that is not causing a symptom? So I totally understand what you're saying. But at the same time, you obviously are very skilled at assessing this pain. How do people kind of identify their own pain when it's not so obvious? Something like, let's take like pelvic pain, where, it's kind of a difficult one because there's so much going on in that area. The body's not telling you exactly what the issue is.
Oh, but see, here it is. Maybe it is. So let's say that you're having pain in that area, kind of at the very lower abdominal region, kind of close to where the thigh is. Okay, that's where the pain is. Let's say that along with that pain, you can sit, but if you try to stand, oh man, that pain gets horrible. So you have pain associated with a postural variation. If it was your fibroid, would that be affected by would that have anything to do with standing? How about, pick another organ, right? No, it wouldn't, right? And if you also said that pain seems to happen if I sit for a while and then I stand, or let's say someone's having pain. Oh, if I stand, but then as soon as I sit down, the pain goes away. You've just associated your pain being increased with activity and being reduced by resting. Does a herniated disc work like that? Does stenosis? It doesn't work like that. So as soon as the person begins to attach their pain to activity, you better start thinking it's muscular. It's intermittent, the pain. If it's a structural variation, if you're going to tell me arthritis causes pain, that process is ongoing. That person better tell me their pain is consistent and never goes away. That's the way it works. That's the way the body works.
So do you have because obviously you're one person, but you now have a method that helps people with chronic pain. So do you have a way that people can do this for themselves, or do you train doctors to do this method? How do you get this out to a wider audience than just maybe your own clinic?
So now you're asking me the question I've been trying to figure out for 30 years. So the first concept is that I wrote a book called The Pain Cure RX, and that book addresses the neck, the back, the mid-back, lower back, gluteal region, shoulder, hip, and knee. And basically, I literally provided the test mechanisms used in the Yass Method for the individual to begin to test and establish which particular muscle may be associated with their symptom at any one of those joint areas. And then I provide the exercises to be able to resolve that. Okay. Then, thank God for technology in this regard. Since 2015, I've been doing Skype and subsequently Zoom sessions for people around the world to help them when they're having their issue. If you Googled me, you would say, wow, this guy is entrenched all over the world. This guy is just adequate. It's nothing like that. I am the tiniest little cog in a gigantic industrial wheel. The only reason someone finds me is primarily word of mouth or Google. You got to be searching to find me. At this point, even after 30 years, I have not gotten the inroads that I would pray for. But I do believe I'm in that process, and I have begun to create a certification program, and we are preparing that at some point we will have to train people to implement this method.
And there's something really important happening and it's this attack on opiates. And I think that like that's a chance to really elevate this message. And I mean, obviously, Sarah and I will, get it out to our listeners. But it's this attack on opiates, in that we thought that opiates was going to be the end of pain. And that's not even at all what's happened. We just created more problems by just giving people a simple pill to take to ignore the pain and sort of separate from reality. But is there a way for us to address this with, don't just take a pain medicine? My daughter got braces yesterday and she's in a lot of pain today. She's like, what do I do? I'm like, deal with it. No, I'm like, take your Advil, like, and it's going to be sore for a while. Like, you're going to recognize your teeth are moving now. But how do we address that so we don't just keep putting people on opiates and saying it's just separate from the pain? Because if you separate from the pain, how am I going to diagnose that pain?
So this is the big thing that people have to try to come to realize. So for 40 years, you have been told the cause of your pain is structural, right? Who can fix a structural problem? Can you fix your own structural problem? If you have stenosis, you're going to fix that? You're going to do surgery on yourself? You can't do anything, right? So what that does is it forces you to basically become imprisoned through a system that says you will either allow us to do surgery on you, or at best, you're going to have to allow us to mask your symptom. And so you could start with Zymbalta, antidepressants, and all these other types of things, anticonvulsants, and eventually maybe you'll go on to Neurontin and all these other types of things. And eventually maybe you'll have to go to that opioid concept. And you don't see any alternative because you see this as a monopoly and you got to do what they say. Or you could start to say to yourself, and this is what I tell people, here's an interesting point. You've been going to this person to resolve the cause of your pain. You've been going for 6 months to a year. You're no better, if not worse. At some point, can you have the courage within yourself to say, I just don't think this guy knows what he's talking about. It's just not working for me. I think I need to go in a different direction. And this really kind of, Russ talks to you, which is about people have to really empower themselves at some point.
Yeah, we totally agree. It's about self-responsibility. And I think you're right. It's a cultural thing. And like I say, certainly in the UK, it's much more ingrained, I find, than anywhere else. This absolute faith in the doctors and nobody deviates. And people will tolerate so much. In England, we've got a waiting list because of COVID. And I know people who've been in serious pain and bedridden, but they're waiting a month for the doctor because they are so disempowered that they would rather lay for a year in chronic pain and wait for the doctor than actually try and do something themselves. But I also think there is a lack of information about what people can do for themselves. That's probably where you come in because, like I say, I've had this pain that I'm doing all these different biohacks and I'm trying to get to the bottom of it. But, I don't have a system for doing that. I'm kind of a little bit just randomly trying things and seeing what happens. So how do we get over the conditioning, which exactly it is? It's people are totally conditioned. And then how do we provide the information so people can take responsibility?
The biggest problem that people have is the recognition that chronic pain is this very new thing. It only started in the 1990s. It's only 30, 40 years old. And the idea that muscle could be the cause doesn't fit the narrative from the entire global medical establishment. So you got this one guy saying this, and certainly the average person's going to say, you're a lunatic. You're out there. Just the mere idea. I've had people say when they've attacked me that I'm equivalent of a non-vaxxer. I'm an equivalent of a non-vaxxer because I don't believe the MRI has basis for identifying the cause of pain. And I find that hysterical because it's not about me. If you want to attack something, attack my methodology, attack the things I say. Is the MRI using correlative theory to identify the cause of pain? If it is, which it does, it's simply saying that if something happens at the time of something, it's the cause of it. That is the basis of correlative theory, which is junk science. If you find that symptoms are not where they should be, if the structural variation identified was to cause the pain, by definition, it would mean the structural variation can't be causing the pain. Well, I found in 99.9% of cases I've treated over 30 years, the symptoms weren't where they should be, right? All the studies show that the MRI doesn't work. How about the surgeries don't work? I mean, it's evident, right? So we need to now say, well, maybe it's not structural. And the best I could do is at least get you there. Then go on and try to do some homework and start understanding how do you interpret symptoms, which is at the core of diagnostics. And if it does show it be muscular, how do we address those muscular causes? Those to me are the critical challenges that I think exist for everybody out there.
Yeah, it's totally amazing that you're almost being cancelled just because you don't toe the line with the mainstream narrative, and then you're kind of put in that class of people who, are totally... Unfortunately, that's why you come in our bracket of rebel scientist. And it should be that you're kind of a rebel scientist just because you are actually following direct observation, which is actually the first thing you need to do in science, direct observation. So, we have got a crazy system, but well done you for kind of standing out there. I mean, you're kind of putting your neck on the line to some extent because, people are going to have these accusations, but it needs to be said. And I think maybe more and more people are beginning to understand this whole thing about sovereignty and personal responsibility. So that's super cool. Maybe you can give us some tips then, because we're kind of coming to the end when we speak to you, but it would be great to have some tips about, because everybody's either in pain or knows someone who's in pain. Everybody who's listening, I expect. What can people do to kind of get started? How can people learn your method? What is your suggestion? And I'm saying this from a personal point of view. I'm ready to, when we hang up, I'm going to follow your actions. So what's your recommendation?
So the first thing, if someone wants some guidance, which I think most people kind of need initially, you could just contact me by email at drmitch@mitchellyass.com. And again, I think if you're doing that through Google, you're going to look at this and say, wow, this guy will never get back to me. I think I'm being used by a higher power. My life has been a very, very strange life and a series of things that nobody could say are coincidental. So I see this as my moral and ethical obligation to do what I do. This is not about me anymore. I'm just a conduit to this thing I'm doing. So if you contact me by email, I will respond. I always will respond. The alternative is to go to my website, Live Without Pains, it's plural, livewithoutpains.com. There's a contact us button. You can contact me that way. You want to learn more about this method, and maybe if it fits into you, you go to the YouTube channel, just Dr. Mitchell Yass. 270 free videos to look at, just about everything from migraine headaches to plantar fasciitis. I talk about it all, and all I'm doing is giving theory. I'm giving theory. I'm not telling someone, come to me. I'm saying, here's the information. If it makes sense to you and you need assistance, then come to me. If you think you can figure it out yourself and do the exercise, God bless. I don't care. I don't care how you figure it out. I just want you to be out of pain and have your life back. That, to me, is the way of reaching me. But the biggest issues are saying things like, if you associate your pain with movement, it's muscular. Don't let anyone tell you anything different. If you find your pain increases with activity and then stops with rest, by definition, it is not constant. If it's not constant, it can't be coming from a structural abnormality. Those two big identifications could lead someone to now say, well, maybe it is muscular, even though everybody's not saying that, and maybe I should go on this path. To me, those are the big jumps that I'd like people to understand.
Well, that's two massive things right there that just give the people that extra awareness. It's a start, because it's so difficult to know where to start with this, and especially if your doctor is saying something. But it is, obviously doctors have an agenda, they have their training, they have their protocols. If we're questioning that, then yeah, you need to have your own measure.
And I think everyone's gone through it. I personally have gone through. I was misdiagnosed 3 times before I was diagnosed with Hodgkin's lymphoma. I was 3 times. 9 months went by before I finally was like, these things on my neck are not just a virus. This is everywhere. And finally, I was so sick, the doctors had to do something. My mom had her appendicitis. They opened her up. They said, oh, your ovary's a little swollen. Did a pap smear. Nothing shows up. She died from ovarian cancer 3 months later. We've all had these issues where the doctors are doing their one singular job and they're not looking at the holistic part of the body. And I think this is where we really have to let agency is so important. And Sarah, I've got to believe here too that there is a gender gap in speaking up. And speaking up to your doctors and having trust in your doctors. I mean, we have a large female audience, Dr. Yass, and I think this is a chance for us to don't just trust your doctor, don't just trust your male doctor or your female doctor. Speak up. And I'm hopeful that, this is a call to arms for everyone out there when they go to the doctors to be like, are you sure I need to go to a specialist for this? Or is this something that I can deal with? My only fear about this, Dr. Yass, is WebMD and self-diagnosing yourself. And I've done a lot of that, and I've ruined many months of my life wondering if I'm actually going through something because I read something online on, on WebMD. How do we get away from the self-diagnosis part where people are like, well, now I have agency and I think I have this, and I brought you my WebMD thing here, and it says I'm suffering from this chronic thing. Like, how do we avoid that part? Like, that part gets me nervous.
My basic position here is that in more than 98% of cases, think about what I'm saying, virtually almost everybody, except for a small percentage, have a muscular deficit associated with their and again, symptom and correlative dysfunction, corroborating dysfunction. Okay. So I'm saying that you don't have a medical issue, you have a fitness-based issue. So if there's a muscular issue, I don't see how anyone could say this isn't a WebMD thing. This is an answer of if I notice that my pain is associated with my function, I don't know how you can't say it's muscular. I don't know how anyone can say that's wrong. So I'm not fighting them. But if I diagnose you, and I've done it twice to people that were in fact bone on bone, legitimately based on physical presentation, bone on bone, I sent them for hip replacements. I'm not trying to steal everybody. I'm basically just trying to say, as an individual with human freaking rights, you have a right to determine what's going on with your body and take some action upon it. You don't have to go to a group of people who quite simply are not educated to trained to know what this is. And most importantly, they haven't said to themselves, I just don't know what I don't know. That's why you have individual specialists making diagnoses where the cause may be from 20 other specialties, but they don't know that, so they have to make it within their specialty. That's something that has to be addressed.
And I suppose also the final takeaway is that you do have responsibility to kind of not get yourself in this place in the first place, like sitting on your bum for like 8 hours a day. I mean, we're all a little bit chained to our computers, but I mean, here I've got like a standing desk. It's a very small concession, but it's something. There are things you can do, get out and exercise, have standing desks, take regular breaks. I think there's also that piece, isn't there? If we understand now that chronic pain hasn't been around that long and it's associated with sedentary lifestyle and looking at a computer, we maybe need to address that too.
So here's the big jump point I would make. Chronic pain is not medical, it's cultural. It's clear that that's what this is about. For the last 40 years, we've ended up sitting on our butts, doing less and less, and now we're having this pain that never existed prior when we were active. So my prayer for every person is that they recognize that they have an ability to empower themselves to get healthier. Eat right, sleep right, reduce your stress, which is the number one killer. That's the thing that's killing everybody is stress and causing sickness, right? Do some exercise, prevent yourself from having pain. I agree 100%. Let's all agree that that's what has to happen culturally.
There is something with, I sat on my ass for 3 straight days. Nothing happened. Woo. But then like 3 weeks later, you're like, God, I feel terrible. Like, just recognize that what you've done in the past has caused this and just get up and start walking around. Now, it's easily said. I know people are in a lot of pain and I don't want to minimize or diminish that. But also to your point, like, yes, eat better, sleep better, listen to the Rebel Scientist podcast, go to Dr. Yaz's website. All these things are things
all of these things you can do. Yes, that's so cool. Well, I think we're definitely on the same page as you, Dr. Yass. So that's totally cool. And it's brilliant to have you on. We're definitely going to look at all of your pages. And then Russ and I tend to kind of look at the pages and then we might do some of the things and we come back on and have a chat about it. So thank you so much. And thank you for everything you're doing. It's super cool. We totally support that. So best wishes with it all. I hope you get that course out so that people can learn a bit more about it.
Thank you for having me and spotlighting the issue. It's real important. And I just hope everyone has a chance to resolve their pain and have the life they justly deserve. So thank you.
Yes, hear, hear. Thank you very much. Take care. Thank you.
Thank you for listening to the Rebel Scientist podcast. If you know someone who would benefit from the topics in this episode, share it with them. Feel free to DM us on all social media channels or email us at sarah@rebelscientist.com. We read and reply to all messages. Don't forget to subscribe to our YouTube channel, and if you're listening on a channel that allows reviews such as iTunes, please leave us a fantastic review. We value your support. It all helps. All opinions of our guests are their own opinions and do not necessarily reflect their views of Sarah Turner or Russ Eisenman. This is not medical advice. If you have a health problem, please seek a medical professional.
The Rebel Scientist podcast is a Breaking the Gray production, hosted by Sarah Turner and Russ Eisenman. Audio production by Dave Visaya and the podcast engineers. For more information and for our biohacking shopping guide, visit rebelscientist.com. To hear more incredible Breaking the Gray production podcasts, visit breakingthegray.com. That's gray with an E. breakingthegray.com.
Breaking the gray.